February may be National Pet Dental Month, but honestly, your pet's teeth are important every day of the year.
And here with more on keeping your pet's mouth healthy is veteran Dr. Molly Brinkmann. We love when you're here. Now, we have heard that pet parents should be concerned about dental care. Why is it so vital?
Yeah, so dental and oral health is really a vital part of your dog or your cat's health. We evaluate their mouths to see what they look like every time we examine them in the office. And for smaller dogs and cats, their dental structure, their teeth being there, are really important for their jaw structure. Dental health affects all parts of the body. Dogs who have disease in their mouth and bacteria that's built up on their teeth, that can affect their heart, their kidneys. They have inflammation constantly. So it's an extremely important part of their health and their total picture. And it's a part of veterinary medicine that's getting a lot of emphasis lately, and that's great because it's so important, and we're trying really hard to let owners know you need to be thinking about this and we need to be talking about it.
And we have some photos of yucky teeth because I'd love for people to see what it looks like and when they should be concerned. So we're taking a look right here. Tell us a little bit about this.
Yeah, so these are easily found in phones of veterinarians. Lots of dogs have advanced dental disease. They're going to have plaque and tartar buildup on their actual teeth. You're going to see gingivitis, so swelling and inflammation in the gums. What you're seeing here is advanced stage dental disease. There's a wide range of what it can look like. But these dogs are painful. They're uncomfortable. They will still be eating. Most of these dogs were probably eating when they came to the vet to be checked out. And so that's not a good litmus test of, does my dog need help in their mouth? They do if you're seeing these changes.
Now, one thing that I know a lot of people get confused about is the non-anesthesia dental cleaning versus anesthesia, and or the groomer does it every few months when I take my dog. You say don't rely on that.
Yeah, so a groomer can brush your dog's teeth, but really you should be brushing your dog or your cat's teeth every day at home if you can.
Just like a human.
Just like a human, because they develop that biofilm on their teeth that needs to be washed away. And so a groomer can brush your dog's teeth, and there are some people who do, I think it's called like happy dentals, where they're not under anesthesia, but that's not a true dental and oral treatment because we're not fully cleaning, scaling those teeth, polishing them, and taking x-rays of what's under the gum line.
And you have an example that I really want people to see as well.
Do.
A dog named Senna, who you have permission to show.
Yes.
Tell us, this is Senna's mouth by the eyesight. Like if you were looking at it, it looked okay.
Yeah, so Senna, we did a cleaning on, we did an oral treatment, we got all of that plaque off of her teeth, and that first picture showed some nice pearly white teeth that we had cleaned off. But if you look here, this is the x-ray of her teeth. So see, we've cleaned her teeth, all that plaque and tartar is gone. If I told you, hey, I cleaned your dog's teeth, you'd be like, great, thank you so much, and go home and think we took care of it. But under the gum line here, you see an abscess. So that lucency around that tooth root that's circled there is an infection. So when I took that tooth out, it was a pocket of pus under the gum line.
Poor baby.
And Muppet had a rupture as well. And what was interesting was a few days prior, her one eye was going squinty. And I had no idea why. I thought, oh goodness, she has an eye infection, I got to take her in. Before I could even get her to the vet on Saturday morning, I woke up and she had blood all over. It had ruptured. Thankfully, she had surgery. She's fine. But you don't know these things all the time. So what can people do?
Yeah, so that's why it's so important to have regular veterinary examinations. They're doing an oral exam to see and grade the disease in your dog and cat's mouth. Really, at-home care is really important for prevention. So brushing your dog and cat's teeth, which is doable. I know it seems daunting, but you can brush their teeth every day. There are great products out there. There are brushes. I brought two kinds of brushes. This is an actual, like a real toothbrush. This is a finger brush that you can just rub their teeth with. You want to get an enzymatic toothpaste that's made for dogs and cats because that's what's going to get that biofilm off. Wipes are a really great product. You can wipe their teeth, and that's going to help with that as well. And there are rinses you can put in their water bowl, and that helps wash that biofilm as well.
Are they flavored, like, or can you get ones that aren't though? What if they don't like that?
So there are different flavors. Yeah, this enzymatic toothpaste is a great one. They have a vanilla mint flavor, but they also have like chicken, and I think there's a fish flavor. So we all have some picky small dogs who have bad teeth. So if they don't like one, you can try it.
Awesome. Thank you so much. I like how you said it. You can brush their teeth. I'm going to bring them to you, and you show me how easy it is to visit Dr. Molly because she's amazing. Check her out on social media, and you can actually visit her at the Gulch location of Good Vets. Take your dog, take your cat, take all your animals in and get her help.